Good afternoon, my good people. Let me start by welcoming you back to my YouTube channel this afternoon. I hope your day is becoming a wonderful one and a fantastic day. Mine too is fine. Let me start by appreciating you people for supporting this channel, because the success of this channel always depends on you, and I do appreciate the far you have taken me and making me part of your family. For those who have subscribed, I do appreciate the returning subscribers. And if you are there and you have not subscribed, make sure you subscribe and put the notification bell on, so that whenever I produce or upload a video like this, YouTube will automatically notify you and you will never miss any of our videos. Yesterday we were talking about lung nodules, and today we are going to discuss on how to diagnose lung cancer, or how will you tell that a person or a patient is having lung cancer. And if you had asked for this topic, I know whoever had requested this topic is getting what he or she wanted. If you are a doctor, or if your doctor believes a pulmonary nodule is cancerous, if your doctor believes a pulmonary nodule is cancerous, they may order for more tests to diagnose or to prove or to come up with a conclusion that the disease you are having is cancerous or not. So in the diagnosis of lung cancer, if your doctor believes a pulmonary nodule is cancerous, they may order more tests. Diagnostic testing used to confirm or rule out cancer includes the following. Diagnostic testing used to confirm or rule out cancer include the following. Number 1, position emission tomography. Position emission tomography scan. These imaging tests use radioactive glucose molecules to determine if the cells that make up the nodule are dividing rapidly. Position emission tomography scan. These imaging tests use radioactive glucose molecules to determine if the cells that make up the nodules are dividing rapidly. Biopsy. Number 2 is what we call biopsy, and I know each one of you who has been following my channel closely can tell what biopsy is. This is whereby a piece of tissue cell is extracted from the affected area and taken to the laboratory for testing to rule out cancer and its staging. So, in biopsy, your doctor may order a biopsy, especially if the results of the PET or position emission tomography scan are inconclusive, or they have not given him or her the diagnosis or what he or she wanted. So your doctor may order a biopsy, especially if the results of the PET or position emission tomography scan are inconclusive. During this procedure, a tissue sample is removed from the nodule. During this procedure, a tissue sample is removed from the nodule. It's then examined for cancerous or cancer cells using a microscopy. During this procedure, a tissue sample is removed from the nodule and it's then examined for cancerous cells or for cancer cells using a microscopy. Sometimes this is done by a needle biopsy that's inserted near the edge of your lung through the chest wall. Sometimes this is done by a needle biopsy. We talked about lung needle biopsy, and each one of us knows what lung needle biopsy is. So, sometimes this is done by a needle biopsy that's inserted near the edge of your lung through the chest wall. Another option is a bronchoscopy, where your doctor inserts a scope through the mouth or nose and passes it through your large airways to collect cells. Another option is a bronchoscopy, where your doctor inserts a scope through the mouth or nose and passes it through your large airways to collect cells. Let's talk about the next steps after finding a spot in the lungs. What will you do, or what next step will you take after finding a spot in the lung? A pulmonary nodule may be first A pulmonary nodule may be first detected on chest X-ray. A pulmonary nodule may be first be detected on chest X-ray. After that, you may need further testing to better characterize the nodule to help determine if it's benign or cancerous. A pulmonary nodule may be first detected on chest X-ray. After that, you may need to further testing to better characterize the nodule to help determine if it's benign or cancerous. Benign means non-cancerous. Your doctor may request your medical history and history of smoking. So these are among the questions that the doctor will ask you to arrive to a diagnosis about medical history and history of smoking. Additionally, very important, your doctor needs to know if you've been exposed to second-hand smoke or environmental chemicals. Additionally, your doctor needs to know if you have been exposed to second-hand smoke or environmental chemicals. The first step of the process is examining the size and shape of the nodule. The first step of the process is examining the size and shape of the nodule. A point to note: the bigger the nodule and the more irregular the shape, the greater the risk of it being cancerous. The first step of the process is by examining the size and shape of the nodule. The bigger the nodule and the more irregular the shape, the greater the risk of it being cancerous. I hope you are with me. Thank you for your time. This marks the end of our video today. Thank you for your support. And I always thank each one of you doing anything, however little it is, being by subscribing, sharing, liking the videos, and making the channel a success. I always appreciate you people because I'm nothing without you, or without your support I can't make these videos. Let's continue subscribing, liking, and sharing so that they may reach as many people as possible. Have a wonderful day.